Hi, in this video we'd like to discuss a specific topic regarding HG again, Hyperemesis Gravidarum. Now this question is whether or not HG patients can enjoy cold foods, cold dishes, ice cream, any cold drinks during pregnancy, even if you've received our HG vaccine at Antai hospital. Is that beneficial or recommended? And to answer that question right now, yes, that is actually recommended. We do recommend our patients to. You can eat whatever you want and eat as much as you want. And even it includes cold food items, cold drinks, cold dishes, ice cream, all of that. Now, many people will believe that it's not beneficial, but let's go into that topic together. So during Hyperemesis Gravidarum, let's focus on the digestive parts. What actually is going on during a patient who hasn't received the treatment yet? What's actually happening? Now, this includes the gastrointestinal regions, and then also the salivary regions where the taste and smell is involved. So because we've explained before that because these women, HG patients, those who develop hyperemesis, they have high amounts and abundant amounts of abnormal H2 receptors that are hypersensitive to HCG, especially in the digestive tracts, places that secrete saliva, sense of smell. All of these are covered with these receptors that once they are exposed to HCG, which only happen during pregnancy, then they are hyperactive and they're constantly secreting secretions and acting up, leading to symptoms and complications of HG. Now, during hyperemesis, the stomach specifically, it secretes high levels of these gastric fluids, intestinal fluids, bile fluids, and which can lead to a common symptom that many HG patients experience, which is first of all, vomiting, excessive vomiting. Secondly, is heartburn. If you feel excessive heartburn, then it means there's too much secretions in your gastric organ. And the next one is saliva, excessive salivation, also known as hypersalivation. This is because the salivary glands are being hyperstimulated to constantly secrete because of the reaction I just explained just now. This can lead to constant, uncontrollable salivation, loss of sense, taste, and also sense of smell. These are all correlated to the same cause, and it definitely can affect the way that you eat food, able to take down any medication. Definitely will lead to complications of malnourishment, dehydration if not managed properly. So the solution to this is definitely come to Antai hospital and receive our HG vaccine. You can see for yourself how effective it is, because within days you will recover fully, being able to eat and also drink. None of the symptoms are already existing anymore. So for patients who have received our treatment and maybe the symptoms start to come back again because the dosage you received is not sufficient, or you're not taking the oral medication that we have instructed for you to take regularly, then sometimes the symptoms come back. And to combat this, when patients ask us, because they start to develop cravings for cold foods, yes, you can actually take cold foods at this time because it's actually beneficial to actually suppress HG symptoms. So when you eat cold foods, what actually happens is that when the cold food enters into the digestive tract all the way into your intestines, into your stomach, this actually forces blood away because of how cold food works. It leads to vasoconstriction, which means the blood volume decreases, blood vessel permeability decreases. This leads to lower amounts of energy delivered to delivered to the stomach, and then also lower amounts of blood secretions, hormones in said blood vessels. So it actually reduces the activity and actually leads to direct suppression of the symptoms. So when patients like this, having hypersalivation, constant vomiting, and also the heartburn, if you observe that you take cold foods, you realize you feel a sense of relief. This is exactly what's happening. Salivation also starts to drop. It will not drop completely, that is why you still need to receive HG vaccine, but it will definitely work in helping you get a sense of relief and help you manage it so that you can actually get to Antai Hospital, make it bearable at least. And because there's lower amounts of blood entering to that gland, let's say the salivary glands, there's less amount of blood, less amount of heat, less amount of secretion, less amount of energy. That means the gland is not that hyperactive anymore, so it's not going to be constantly stimulated before that. So ideally you do receive our HG vaccine first, but this is definitely something that we do recommend. Rest assured, eating cold food items during pregnancy will do nothing to actually affect the development of the pregnancy. In this case in particular, it actually brings you benefits, give you a sense of relief, and also suppress the symptoms temporarily. So the message is you should be able to eat anything you want, however much you want, regardless of temperature, if you do observe this type of symptom even after receiving our HG vaccine. But do make sure to actually receive the vaccine so that you can see the symptoms cease completely, and do make sure to follow our instructions when we give you the oral medication to support your HG recovery. So to find out more information about our HG vaccine, whether in injection form or oral medication, please visit our website, read our articles, set up a consultation today. Your hyperemesis gravidarum can be actually treated and even effectively prevented to ensure that you do have a successful, smooth pregnancy with Antai Hospital. Please stay tuned to our next video and also leave me some comments down below.